We have been joined by the Minister for Health and Ambulance Services in Queensland, Honourable Cameron Dick, but we've also been joined by Aaron Harper. So can I welcome Aaron to the meeting as well? We've been fortunate working with Minister Dick since he has been the Health Minister around a range of issues, but we're absolutely thrilled that leading up to the launch of the Advancing Health 2026 strategy, which the Minister did at our first forum, which was held in Brisbane about 12 months ago, that strategy engaged consumers very much at the centre point of that strategy, and a couple of those consumers are here today. It's fantastic to see a strategy that is all about making a difference for consumers, patients, their families, their carers. So with those few words, I'd like to introduce the Honourable Minister, Cameron Dick.
Well, thanks very much, Mark, and great to be in Townsville today. Anyone from Townsville here? Got a few people from Townsville? That's great. You can thank me later for bringing the rain. I know it's been a bit of an issue up here, but great to see the rain in Townsville. It's always so pretty and beautiful and sunny when you're in Townsville generally, and warm. But it's great to see the rain, and hopefully that will continue for a little while. I know the city's been battling with water challenges. I want to acknowledge my parliamentary colleague, Aaron Harper, who's here, the state member for Thuringowa, worked for many years as a paramedic, and wanted to come here today to show his support for health consumers and Health Consumers Queensland. So thanks for joining us, Aaron. I know Scott Stewart. Yeah, give me a... That's great. Thanks for acknowledging Aaron. I know Scott Stewart was here earlier, the state member for Townsville, and Aaron and I have just been at the hospital announcing that body-worn cameras will now be used by our security guards at Townsville Hospital. So we've got to keep our staff, we've got to keep our patients, and we've got to keep families safe. And that can't just be done by government, that's got to be done by the entire community to say no to violence and abuse wherever it may occur in our society. Can I respectfully acknowledge the traditional owners of the land where we gather today and pay my respects to elders past and present? Can I acknowledge your chair, Mark Tucker-Evans, and the board members who are here? Can I acknowledge your CEO, Melissa Fox, and thank them for the work that they do, and I'll be saying a little bit more about that. And can I thank you for inviting me to come back again and to, I think the thunder's a good sign, isn't it? Anyway, I'm taking it that way. Thank Health Consumers Queensland for inviting me again to your second forum today. Health Consumers Queensland, of course, plays a vital role in our system, not the least by reminding us of that which is often overlooked. For all we may talk about our investment in hospitals, for all the deserved commendation we lavish on our amazing staff in healthcare in Queensland, for all the tributes we pay for the performance of our system and the quality of the care it provides, we must always remember its purpose. We serve the patient. Health Consumers Queensland has been instrumental in drawing our focus back to the truth, ensuring the patient is not on the fringe but is at the centre of our health system. Health Consumers Queensland provides a platform from which to launch that engagement as a way not only of critiquing policy but of shaping it. I'd like to pay particular tribute to your chair, Mark Tucker-Evans, and to your CEO, Melissa Fox, for the professional and valuable way in which they have engaged in the development of health policy in our state. They've been involved from the beginning with our nurse-to-patient ratio legislation, with our specialist outpatient strategy, and with our community health action plan. In all their contributions, they have brought the important perspective of the consumer and an extraordinary capacity to consider a project from its end point, its consumption, and work backwards. One of the earliest initiatives of the Palaszczuk government was the restoration of funding to a number of non-government organisations that had been defunded by our predecessors. I was particularly pleased to return funding to Health Consumers Queensland so that you could be properly funded to continue your important work representing the voice of consumers. Yeah, why don't we give... Thank you. Because you do great work and you deserve to be supported. Last year at this forum, I launched My Health Queensland's Future, Advancing Health 2026, a 10-year vision and strategy for Queensland's health system. Our vision is that by 2026, Queenslanders will be among the healthiest people in the world. Advancing Health 2026 was developed in partnership with health consumers, clinical and non-clinical representatives of the public health system, private and non-profit health providers, universities, professional organisations, unions and other key stakeholders. This was vitally important because government alone cannot respond to the challenges facing the health system because government alone does not have all the solutions. Our health system ranks amongst the best in the world, but like all contemporary health systems will face significant challenges over the next decade. These challenges include an ageing population, increasing demand for health outcomes and the rising incidence of chronic disease. There is a robust need for us to be able to deliver better health outcomes through innovation and research. By working together and implementing the strategies contained in Advancing Health 2026, we can overcome these challenges and take advantage of opportunities to benefit health consumers, their families and the wider community. In particular, Advancing Health 2026 outlines 4 strategic directions that are guiding the achievement of our vision: promoting wellbeing, delivering care, connecting healthcare and pursuing innovation. These are the principles that inform the health direction of the government. I've made it clear to the department that they are not to be thought of as mere slogans or the subject matter of brochures to sit on some shelf. These principles must guide our decision-making, must direct the programs and must set the benchmark for our policy initiatives. They must become the milestones against which we measure our progress. Initially, we focused on Queensland Health, ensuring that our activities were aligned with Advancing Health 2026 and putting the consumer foremost in everything we do. For example, Advancing Health 2026 has informed the Department of Health's strategic planning, as well as hospital and health service strategic planning and our service agreements. Over the last 12 months, we have been working hard to implement these directions. Under the Promoting Wellbeing direction, we have delivered a range of preventative health initiatives, including the 10,000 Steps program, Heart Foundation walking groups to increase levels of physical activity, and social marketing campaigns to promote the consumption of fruit and vegetables. We've implemented legislation which extends the range of smoke-free places in Queensland to include a wide range of commonly used community transport, recreational, sporting, childcare and educational facilities, protecting adults and children from the harmful effects of second-hand smoke. We've invested $6 million over 4 years to continue the statewide pre-exposure prophylaxis or PrEP trial, promoting wellbeing by helping prevent people at risk of HIV infection from becoming ill in the first place. Research shows PrEP can dramatically reduce the risk of contracting HIV. More than 1,200 Queenslanders are participating in our expanded trial, which has the potential to virtually eliminate the spread of HIV in Queensland by the end of the decade. We've invested almost $10 million over 3 years for a suicide prevention in health services initiative. Specially trained frontline staff in our health services are uniquely placed to be able to recognise, to respond to and to care for people who present with a suicide risk. Under our Delivering Healthcare initiative, we have legislated minimum nurse-to-patient ratios in the state's public sector health facilities to ensure resourcing is matched to patient needs. This helps us to deliver healthcare by creating better outcomes for our patients and improving safety and wellbeing for both our patients and our hard-working nurses. Part of delivering healthcare is making sure people don't have to wait too long to get the care they need. So we've implemented a specialist outpatient strategy which has reduced outpatient waiting lists. When we came to government, there were 104,000 Queenslanders waiting longer than clinically recommended for an outpatient appointment. Today, I'm pleased to announce that despite increased demand in our system, that number has halved. Delivering healthcare means listening to our consumers. That's why we legislated to allow medicinal cannabis products to be prescribed and dispensed to patients in Queensland and to prevent unauthorised use of these products, meaning that certain very sick people, including children with a range of serious conditions which have not responded to conventional treatments, are able to access medicinal cannabis under the care of a doctor in a safe and legal fashion. Under the Connecting Care direction, we have invested in our hospitals through the Queensland Health Capital Investment Program to ensure staff, patients and communities have access to contemporary health infrastructure that supports the delivery of health services. And that includes $230 million over 5 years for our Advancing Queensland Health Infrastructure Program. Another way we're connecting healthcare is through our nurse navigators, and I was just very, very pleased to meet one of our nurse navigators working in the Townsville Hospital just a little while ago. Over the last year or so, we have introduced 121 nurse navigator positions across all of our hospital and health services, with another 119 positions to fill in 2017. What does this mean for patients? Well, this means that patients are able to speak to a highly experienced nurse who acts as an expert guide, providing advice and ensuring that they get the right care and are seen by the right person at the right time, in the right place. Under our Pursuing Innovation direction, we have begun development of a health research strategy which will provide a framework to help guide Queensland's health research investment decisions and actions. We've also made the first allocation of our $8.5 million funding program. $8.5 million from our funding program, $35 million in total, our Integrated Care Innovation Fund. 8 great projects have already been funded, with more to come, to better integrate primary health care with what we do in our hospital and health services in the acute and subacute place. This fund does exactly what it says. It provides financial support to innovative projects that deliver better integration of care and address fragmentation in services. We've continued to pursue innovation with the rollout of our Digital Hospitals program, with integrated electronic medical records implemented in 6 Queensland public hospitals. Patients at the Princess Alexandra Hospital, the Mackay Base Hospital, the Townsville Hospital, Cairns Hospital, the Royal Brisbane and Women's Hospital, and at Children's Health Queensland, particularly Lady Snedo Children's Hospital, are all now benefiting from components of the integrated electronic medical record. The goal is paperless shared records, one patient, one record, providing more consistency, more convenience, and very importantly, more safety. The Princess Alexandra Hospital, Australia's first large-scale public digital hospital, has now rolled out the final release of the IEMR digital program. The hospital is now completely digital because they've rolled out our Medications, Anaesthetics and Research Support Program, or MARS. MARS is delivering improvements to patient care and safety through more accurate and efficient prescribing and administration of medications throughout a patient's journey in Queensland hospitals. And just yesterday, I attended the eHealth Queensland Expo with almost 2,000 other delegates, which focused on the role innovation and technology can play as part of the 4 directions of Advancing Health 2026. But for Queenslanders to be amongst the healthiest people in the world, we all need to play a part. That's why I established the Advancing Health 2026 Oversight Committee. The committee includes representatives from across Queensland's health system, research and academia, local government, including the Mayor of Townsville, Councillor Jenny Hill, and health consumers. In particular, I want to thank Mark, the Chair of Health Consumers Queensland, for his role on that committee. The committee will work with me to identify opportunities for collaborative action to make our vision a reality. We'll continue to work with our partners to align our efforts and to continue to improve performance. We'll also continue to work with consumers and consumer organisations such as Health Consumers Queensland to develop and implement initiatives as part of Advancing Health. Many of you have heard me say time and time again that the health portfolio is the most human of all portfolios in Queensland Government, and the one that most clearly articulates our human ideals. Investment in health is really at its heart our evocation of the value of individual life. That is the truly gratifying thing about our system, that we keep trying and we keep fighting. It's an ideal and a system worth fighting for. We must resist at all costs the principles that characterise the American healthcare system, where a particular diagnostic test or a specific surgery must first be subjected to the approval of an insurance fund, or where a person who does not have insurance is abandoned altogether. We must fight against any systemic change to funding that forces an individual to choose between illness and poverty, or that allows governments to walk away from their responsibility to provide adequate funding to our health system. Our health system stands as the greatest monument we have to our collective community values. We often talk about hope, but it's not just hope, it's also expectation that is the true signifier of our success. If health is about anything, it is about the irrepressible dynamic of change and the knowledge that whilst we might stand sometimes on unstable ground, that does not shorten our reach or diminish our ambition as we constantly strive for new and better ways to deliver healthcare. Our health system provides an essential component of our social architecture, and it is the touch point for care, the touch point for care that each individual turns to and returns to during the course of their life, often at times when they are at their most vulnerable. And it's at those times that they need a champion. It's then that they need Health Consumers Queensland. So thank you, most sincerely, for the work that you do. Together, I know we can make Queenslanders amongst the healthiest people in the world.
Thank you very much, Minister, and I've got to say that it's an absolute privilege to be on the Oversight Committee, and Paul Woodhouse, who's the Chair of the North West HHS, who's here today, is also on that, along with, as the Minister said, the Mayor of Townsville, Jenny Hill, but also Sheila Cronin, Dr Sheila Cronin, who represents the PHNs on that Oversight Committee. So you can see that, in fact, your region is very much covered by that committee. So thank you very much. We're actually going to do a little bit of room shifting or changings of